All right. Good afternoon, everybody. Thank you all for dialing into our wellness presentation, Well Informed Navigating Back to School Challenges. We're going to go ahead and give it a couple more minutes for others to join us. But in the meantime, please feel free to say hello in the chat box. And we'll get started at about 1:03. All right, everybody. Thank you again for dialing into our Well-Informed Navigating Back to School Challenges. All lines are muted for the remainder of the presentation. However, we will have a question and answer portion of the presentation at the very end, where we encourage you to type your questions in for our presenter. Summer is nearing its end, and that means that our kiddos are either going back to school or are already in their new classes. Although it can be a very exciting time for the family, it's still not without its caveats. Changes in schedules, new class stressors, new school stress, or even separation anxiety. There are a myriad of things that can remain at the front or back of the mind as this chapter starts, and managing them doesn't have to feel overwhelming. Today, we're going to discuss some of those common stressors and ways to set yourself and your family up for success as back to school goes into full swing. To help us learn more and help address these concerns, we are pleased to be joined by Dr. Scott Lighting. Dr. Scott is a clinical and sports psychologist that specializes in treating elite athletes, dancers, and performers. In addition to sports psychology, he provides clinical psychology services to treat conditions such as depression, anxiety, stress, and relationship issues. Outside of the office, Dr. Scott is active in the sports community and enjoys playing football, basketball, hockey, and pickleball. He takes pride in raising his three kids and always utilizes a family first mentality in his work life balance. Thanks so much for being with us today, Dr. Scott, and I'll go ahead and turn it over to you now.
All right, thanks so much, Dakota. Appreciate the intro. And yep, I'm just like you. Parents out there, caregivers out there, our kids are either starting school already or are about to start. Mine are about to start in just a few days here. So I know for me, it brings on a lot of emotions, lots of different emotions, and I'm sure it does for you all as well. So we're going to talk about those emotions and talk about how to make them mostly good emotions, despite how many different things can be happening all at once, right? So we're going to talk about a lot of different things today. And I also want to have you talk a little bit today, or at least think a little bit if you're watching this recording. So what I want to ask you all that's listening to this right now, for those of you that are here in this moment, would love to see a couple things here in the chat. But I want to ask the classic therapist question about how does that make you feel? So what I mean more specifically is when you hear the words back to school, how does that make you feel and why? So for those of you that are here, type it into the chat. For those of you at home watching this recording, just think about what emotion comes to your heart when you hear back to school, a nice long hyphenated word, back to school, and then also why. And so for me, if I were to type in the chat right now, I would type in overwhelmed because like I said a second ago, just so many things going on in life right now. I'm coaching baseball, which starts tonight as well. Like I said, my kids' school starts next week. I got my other two kids doing extracurricular activities. So I would say my emotion would be overwhelmed with some other emotions as well. But again, just think and feel about what yours are and what just that triggers in you when you hear back to school. But just like Dakota said, we're going to talk about a lot of things today to help alleviate some of that stress that might come with this summer ending and going back to school. So the way we're going to do that is by talking about our goals here, which is discuss back to school stressors, which we're doing right now and you're doing right now. We're going to get some tips that can help you and your child navigate with resilience. Resilience is one of my favorite words of all time in mental health. We're going to talk about how to increase that a little bit for our kiddos and for us. We're going to explore ways to proactively address learning and social concerns. We're also going to review keys to year-round success, and then also talk about your EAP benefits that will help you with this process as well. So we got a nice 50-ish minutes together, but also if you need some help after that, we're going to talk about the great resources you have through your EAP program. And so with those emotions that I felt, and somebody else in the chat mentioned that they're anxious, and yes, that is a cousin of my overwhelmed feeling. The next one or right beside it would be anxious. So definitely been having some anxiety with this process as well. But then we might have some positive emotions out there. Maybe you were like, oh, finally, these kids can get back to school and stop going crazy at the house, you know? So I have that one as well. So it's a mixed bag of emotions for me, and maybe for some of you out there. But a lot of us might be thinking that we're relieved, like I just mentioned, or potentially unprepared. I know I felt that way over the past couple of weeks for sure. And I tried to get organized, like we're going to talk about in a few slides from now, which helped me feel a little bit better about this process because I felt like I was behind the eight ball a little bit. But then, you know, some of us might feel hopeful. They want to maybe have a better year than their kids had last year. So this is something that we can feel as parents and caregivers, but also our kids might feel a lot of these same emotions as well. And if I can really recall, and if you can think about what it was like on that first day of school for us when we were in middle school, high school, let's say, like there was a lot of anxiety for me and just that like anticipation of who's going to be in my class, what's my teacher going to be like all these different emotions can occur for us. And again, also our kiddos as well. So some other sources that might pop up that maybe we didn't think about, but your kids might be thinking and feeling about is our schedule changes. I know for me, like part of the reason why I wanted to be a head coach for my son's baseball team was because I wanted to pick the days that we practiced, because I got my daughter doing theater and then singing, and then we got baseball, and then my other son's doing soccer and also theater. And I was like, I need to just pick the schedule. So now I'm dedicated to being coach for the entire season just so I can have my Monday through Sunday, literally, you know, kind of somewhat in control, right? So that's a big one that we might be feeling. Separation anxiety is another one. I'll never forget when my kids would go to preschool, you know, daycare for the first time. They would be looking back and just crying, and like you feel so bad as a parent. You're just like, okay, have a great day, sweetheart, love you, bye. But then they're just like bawling their eyes out. So I know a lot of parents out there know what I'm talking about. So the kids have a tough time, but also I've had a tough time with separation anxiety and just, you know, not having my kids all day. And especially, you know, my daughter has to take the bus now, so it's a lot of time on the bus and away from home, and it's just tough for me personally. So that's one that I identify with for sure. Loss of control. We might not like dealing with that, with knowing that our kids are just on their own all day when we've been taking care of them for the most part all summer. Same thing with educational success. We worry about that, but they might be stressing about their grades. I see many high schoolers in my practice that are freaking out about SATs and grades and college. These are things that our kids are low key worried about potentially, or high key worried about potentially, just depending on your kid's mental makeup. But this is probably the biggest one, I would say, is the worry about social success. So that one is one of the biggest factors that goes into this equation of just how our kids are going to be doing, is if they feel a sense of belonging, they feel like they are connected with people, they feel safe and secure in their attachments, then life is usually good. When our kids are struggling, it tends to be because of social issues and interpersonal problems. So all of these things, or hopefully not very many of these things, can occur just depending on everything that goes into the first day and then the next few months of this fall school year. So these are just some things to consider and maybe even ask your kids about. And we're going to talk about how to do that in just a couple slides here. But here's our ABCs that we need to focus on. So there's the ambiguity about just things being unpredictable and not sure what to expect, and that can be really challenging for us to deal with. And sometimes our minds go to negative places. And so what we need to do with that is allow the discomfort. We need to try to just label it, kind of like what I did a few slides ago in the intro. It's like, how does that make you feel? Sometimes we're just so go, 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 and we're automatic and we're just on autopilot. So if we can try to step back and just name and label the emotion of, like, I'm feeling overwhelmed, or I'm feeling anxious, I'm feeling distressed, then that will help us be aware of it and be able to potentially mentally or emotionally or behaviorally make us feel better if we can just understand what we're feeling and then do something about it. When we're anxious or we're stressed or overwhelmed and we don't acknowledge it and we just are go, 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 then we tend to think more negatively and do more negatively. So try to allow that discomfort, name it, label it, and then do something with it. Another one is bumps in the road. This is unfortunately one of the most significant themes that I see in my practice with people that struggle with anxiety, or just maybe depression, just negative thinking, is the what ifs. My I would say probably majority of my patients, when they have their what if questions, it's never a good thing. It's always what if, and then insert this bad thing that's going to happen. So it's never like, what if like my life is amazing, or like, what if they have like the best first day of school? It's usually the negative. And unfortunately, that's what I see in my office. And we have to say, by the way, there's other what ifs. Like there's plenty of other neutral or positive what ifs that are out there that maybe we didn't think of, or our mind didn't let us think of. So when we have these negative what ifs, we have to try to allow for and accept imperfection. We have to understand that it might not be the most perfect day, but it's probably not going to be the most catastrophic day like your mind predicted with these what if questions. Okay, so just keep that in mind. And then also with change, like I mentioned a second ago, we don't like the unknown. We want things to be predictable. We don't like having to deal with different changes in our lives. And one thing that I want you to do, and a lot of this presentation is a pep talk for you all as parents and caregivers, but also I want you to tell this to your kids as well, is recall your past transitions. Like, you have so many years of wisdom. You have so many years of experience of your life resume, of your parental resume, of your kids' academic and social resume. Like, they've done this before. And when our minds think like, I can't cope with this, how am I going to figure this out? How is this going to go? Lean on your wisdom and your experience. You've made it through each of those years. Sometimes, limping to the finish line, sometimes racing to the finish line. But regardless, you've made it through this, and so have your kids. So let's give ourselves and our kids gentle reminders that they're way more wise than they probably think that they are, and that think that you are as well. So just keep those things in mind. And then also, when we talk about some of these worries, here's probably one of the most important slides today that we're going to talk about is this one right here. So I want to camp out here for a second. So this has played out in real time over the past week, because I'm in North Carolina area, but I also see a lot of patients in Florida. That's where I was born and raised for 30-ish years. So they started school in Florida a couple weeks ago. So I've been talking to my patients about their kids and their transitions back to school already. And this is how this evolved into my real life as well. So you're going to see how interesting this is. Fully true story, verbatim. I'm going to say how it happened. So I was talking to one of my patients a couple weeks ago, and their kid had their first day of school in high school, and they texted the mom, "Hey, I'm really upset. I only have one friend in all of my classes. Like, this sucks." And the mom wrote back, "You'll make new friends." And then they went back and forth with the kid having a lot of resistance, led to the conversation that afternoon, led to a lot of resistance. And then interestingly, same thing happened in my house with my daughter last week when she got her class schedule, texted all her friends, and she came down the stairs and said, "Mommy, Daddy, I'm really upset. I only have one friend in my classes, and that's it. I'm really upset about this school year." And then my wife literally says, "You'll make new friends." And I looked at her and I said, "Hey, I got this one." Right? And I'll tell you why. So what I talked to that patient about, which is what I talked to my wife about as well, and what I did with my daughter, is I made sure that we validated and empathized her feelings first. So what we do as parents, we are trained to not want our kids to have any distress, right? We want to alleviate their pain. And as good parents, that's what we're supposed to do. But for feelings, we need to let our kids and adults really experience those feelings, facilitate emotional expression of those feelings, validate those feelings, attempt to understand those feelings. And that can be even more helpful than rescuing them from their feelings. What happened with my wife that she was about to do, what happened with that patient that I coached a couple weeks ago, was the kids were pushing back. They were like, "No, you don't get it. It's going to be terrible." And then they almost double down on their misery when we try to just rescue them and make them feel better. So, you can do that second, though. I want to make it very clear. Do the rescuing stuff second. But first, try to validate their experience. Ask open ended questions like, "Help me understand what you're going through." Right? So that's not like a yes or no question. They have to be like, "Oh, like I'll even say like, paint me a picture or like illustrate, how this is, how you're feeling about this." Just some way to draw out their different perspectives, their different deeper emotions, and then validate them with like, "Wow, that must be really difficult for you." And that's what I said to my daughter. I said like this, "You must be hurting right now because you feel like you're probably feeling pretty lonely at this moment." And then she's like, "Yeah, like I'm really upset about it." And then I did a lot more validation, a lot more empathy, a lot more understanding, and then eventually got to the rescuing, and eventually she saw my perspective. But when we do the rescuing first, they just want to push back. And that makes sense, right? It's like as adults, let's just say you lost your job and you were really upset, freaking out, all kinds of emotions about it. And then one of your friends was like, "Listen, don't freak out. You'll be fine. You have a great resume. Like, I know somebody, I'll get you a job." Like, you'd feel invalidated. You'd feel like they didn't understand. You'd feel like, "Just let me have my feelings." And right, because those are normal feelings to have if you lost your job. Like, we don't expect people to be like, "Oh yeah, I lost my job. I'm super pumped about that. Like, I'm so excited for my new journey." Like, we'll eventually get there, but it actually takes longer and can be more difficult if we don't have that emotional catharsis. We don't have that emotional validation. So I've been coaching a lot of parents about this one. I've been coaching myself about this one because that's not my norm. In my practice, it is as a therapist, but like at the house, sometimes I'm like, "Rub some dirt on it and get out there. Let's go." So I had to be like, get that in check and just make sure I went into therapist mode for my daughter. And sometimes as a parent, we have a lot of roles, and so being a therapist to your kids sometimes is going to be crucial, especially if they had a bad first day of school, or just dealing with all kinds of stressors that we talked about a few minutes ago. So again, normalize, validate, empathize, and just try to reflect what they're going through. I'm telling you right now, that will create more of a connection with your kids, and they'll be able to talk to you more about things versus if you just invalidate them, then they're going to just be texting and venting to somebody else as opposed to talking to you about it. So keep that in mind when they have their back to school worries. And just to go over some common fears for a second here, We mentioned a few of these, but just fitting in is that number one, making friends and bullying. We're going to talk about in a few slides from now. And like some of these academically as well. Like for me, I remember back in college when you go over the syllabus for the first class, like that's all they really do is just go over the syllabus. And I would always get so overwhelmed. I was like, we have to do all of that in the next like 3 months. Like, how are we going to do that? And then you go to the next class a couple hours later and like, you have to do all that in the next 3 months. Like, how am I going to do that? Like, that was my emotional experience every time we went over the syllabi. And I was like, oh my gosh, like what did I get myself into? But slow and steady you get there. But yeah, so there's a lot of fears that our kids might have, and focus on that communication about the validation, the empathizing, etc. That's going to be key in that. But also, I want you to think about what coping skills you're giving your kids. And for those of you that are here, put in the chat what coping skill you've ever given your kids to de-stress. Like, what do you tell them to do when they're stressed? Like, what do you recommend that they do? So type something in the chat if you'd like to participate in demonstrating what you've taught your kids to do when it comes to coping. But a lot of us haven't really taught our kids coping skills. Like that's something that we do as therapists all the time. But like a lot of parents will say, well, I have my kids do sports, or like I have my kids go for a walk, or I have them read a book, and those are, or like take a nap or something, like, and those are all great, but we can't really do those in school, right? Like we can't be like, hey, by the way, my mom says I need to go take a walk when I'm stressed, and like I'm feeling stressed right now, so I got to get out of this history class. Bye. Like they'll be in the principal's office in no time, right? So, but there's a lot of things we can try to teach our kids from the therapeutic standpoint. Like somebody mentioned in the chat, like breath control. That is probably the number one thing that I'd recommend with any human being, regardless of the age, is just learning how to do some deep breathing and diaphragmatic breathing where it calms our minds and our bodies down. And so that's a great one to do. But there's also many other things that we can teach our kids. For example, like just talking to them about these unknowns, those what ifs, and instead of having question marks on things, just help them put periods on things. Another one would be like trying to change the channel. That's another technique that we use with kids, and just kind of visualize them with this negative image that they're seeing, this negative movie that they're watching in their minds, and then just have them try to change the channel and view something more neutrally or more positively. I guess we should call it like change the app now, right? Instead of change the channel. But those are just a couple techniques that you can use. And at the very end, I'll talk a little bit more about this, about your EAP benefits. But there's these unlimited clinical telephonic consultations that you all have access to. So if you don't want to sit down with a therapist necessarily, you can just call up a mental health expert and just say, hey, some guy on some seminar was telling me about coping skills. Like, what are those, and what are some good ones that I can give to my kids? And they can just give you a bunch of resources, guidance, and help you from the mental and emotional side prepare your kids for school. So just think about that and what you've taught them, or what maybe you haven't taught them and need to teach them as they're going back to school and they're developing and needing to do different coping skills in the moment to deal with stress, not just after the fact, to deal with it using your extracurriculars and things like that. All right. And then a couple of distress signals that I want to go over. And when I say these things, I don't want you to say, oh, my kid is scared of the dark, so like they must have problems and they need to see a therapist. That doesn't mean that, right? Like a lot of kids are just normally scared of the dark. Heck, I'm scared of the dark sometimes, so like if I'm being honest. So like, it's not a big deal if they have some of these, but just know your kids. And if your kids are struggling, or they just seem off, or just they're doing something that they normally wouldn't do, those are some of the indicators that if they start adding up, those might be some red flags to say, you know what, maybe I should see a therapist for my kid using my EAP benefits that I'll talk about in a few minutes here. So look for things with preschoolers like bedwetting or sleep disturbances. Sleep disturbances could be at any age, by the way, so watch out for that one. Loss of appetite, regression, if they're just a 5-year-old, but they're acting like a 2-year-old now, like that could just be a sign of distress that they're going through. Elementary age, irritability, aggressiveness. That sounds like teenagers, right? So these things can transcend to different generations and different developmental stages. But nightmares is another one. Withdrawal and social isolation for sure for elementary or teens. Sleeping, eating disturbances in teens. Conflicts. Physical complaints, like they might start identifying some of the stressors and physical manifestation of those stressors, like we do as adults, as teenagers, and or impulsivity, risk taking. So watch out for those. But these are some of the symptoms, but there's many out there, like significant reduction in grades, or maybe they don't want to do the fun things that they used to do. There's lots of different potential signs or symptoms of distress. And doesn't mean that they have a mental health disorder, but just could be dealing with some kind of stressor that needs to be treated with properly, right? So just be on the lookout for some of those. And as far as some of the practical stressors that we need to address, there's a few tips I want to give over the next few slides, right? So try to shift into this back to school gradually. Like the second bullet point of getting physicals early. I got an email from the school nurse last week, said, hey, your daughter needs 2 vaccinations. You better get those, otherwise you can't start school. And I was like, right, got it. So I did those last week, knocked them out real quick. So these things can sneak up on us, and I wasn't aware that she needed anything going into 7th grade, but I guess she did. Look out for transportation details. You should love this one, being at Chicago Transit. Transportation's a big one. Carpooling, like see who you can try to meet, see who's on your street or near you. Try to work out those transportation details. That can be a game changer when it comes to all these different extracurricular activities or just getting to and from school. Try to do all your back to school shopping sooner than later. That's another one. And then also just here's some other things as well. Let's just talk about transportation again. Try to review safety precautions. Again, you all are experts at this. So I'm preaching to the choir here, but like one that popped up for me last year was my kids started taking the bus, and it took one of my kids coming to me and saying, hey, when we got off the bus driver had to honk at a car that wasn't going to stop. And I was like, oh my gosh, because I'm on like a little quiet street, but I didn't think that anything like that would occur, but it did. So now I had to talk to them more about safety and what to do when this happens, what to do when that happens, and now I'm out there waiting for them for the bus versus just trusting them to get home by themselves. So like there's a lot of safety things that we need to talk about with our kids. Another one would be our home alone guidelines and rules. You all will be getting a handout after this seminar that will be emailed to you. So you should have on that 7-page handout a lot of great information, but on one of the pages, it's like a checklist for some of the safety things you need to think about for if our kids are home alone. And also check your state requirements on the ages. They're all very different. I was looking them up earlier, and I can't speak on them specifically because I want you to do your due diligence, but they're just very different ages in different states. So make sure about that. Check your checklist that is on your handout that you'll receive after this webinar, and just go over these things with your kids. Try to do it beforehand as opposed to just after the fact, for sure. All right. And so some other things we should try to be proactive about is if there's any learning concerns. So I'm going to say this as a coach, and my wife is actually an educator. So one pet peeve of mine is when parents don't get to know me at all. When I'm coaching or when my wife's in education as a teacher, like they only come to you when bad things happen. What I want you all to think about is meeting your kids' teachers, meeting their support staff, meeting the admin at your kids' school. Do all of that beforehand. Like check in with them every couple of weeks. Hey teacher, how's it going? Do you need any support? They'll probably say nope. Or they'll probably say, can you donate more glue sticks? So be careful. They'll try to get you for that. I don't know why they need so many glue sticks and lots of tissues and whatnot, but they do, I guess. But try to build rapport with them. Get them on your kids' side. Get them on your side. So if anything does come up, you already have that established relationship with them versus a potential conflict happening if something goes awry in the classroom. So try to go to the open house, try to email them, try to set up a meeting if needed every once in a while. Like be present in your kids' academic life with regards to meeting their teachers and all the people that go into their education. I think that's a really great one to try to do. So I wanted to emphasize that one, absolutely. And then another one is expectations. So I mentioned a little earlier, as I work with a lot of high schoolers just freaking out about their grades, having legitimate panic attacks, anxiety, perfectionism, et cetera, et cetera. So try your best to set your expectations high, but set them on the effort and not the outcome. And what I mean by that is, instead of saying, hey, if you get all A's, you're going to get these cool pair of shoes or something. Instead of that, say, you know what? If I see you putting the effort, and effort is defined by you studying, you working hard, you showing me your work, and then whatever the grade is, that's what I want to reward you on. That's what I want to praise you on, is your effort. Because as we know, like, not every brain is the same. So like, my kids are all different. I got three completely different kids, same parents, completely different kids. So they're just, and that's just my three kids. So imagine the millions of kids that are out there. So I don't want to set expectations about the outcome or the performance. I want to set the expectation of their effort and the hard work and the process, as opposed to the outcome. So think about that for your kids. Like, what are we really reinforcing here? Are we reinforcing their effort, or are we reinforcing the outcome? You can do a little bit of both, but a lot of parents neglect the process of things. And same thing I'll tell my kids tonight on our first baseball practice is, I care about, did you do your techniques? Did you do everything? If you didn't hit the ball, that's okay. You struck out, no big deal. I'm proud of you for doing everything right. And just sometimes it doesn't work out. So same thing happens on a test. We get the grade that we didn't want to get, but we tried hard. We put our best effort in. That's all I care about. So just be mindful of that as a parent, about the outcome versus the process. And as far as some social concerns, I want to camp out on this slide again as well. This is another really important one. And we need to have our kids build confidence. Focusing on the process as opposed to the outcome is helpful in that process, but also, like, really building them up. And I want you to think about this now as a parent or caregiver that's here or watching the recording. What's your praise to negative feedback ratio? Right? Is it more negative? Like, do we catch our kids doing things negative and point out those things that they're doing that are not so good? Or do we point out the positives? Do we point out the amazing things that they're doing? Do we catch them doing good and then let them know about it? So think about what your ratio is. Is it more negative, more positive? And then what is that ratio? Is it 5-1 or 3-1 or 1-1? And in my opinion, my biased psychologist opinion, I admit, is we need to have way more positive than negative. Like, I love the phrase, like I said, catch our kids doing good. It's easy for us to point out when they're doing something wrong, and like, that's automatic. But seeing them studying, like, go over and pat them on the back and say, hey, I'm really proud of you for putting in this effort right now. Boom. That's an easy one. Versus, hey, stop watching TV. What are you doing? You got to get your work done. Let's go. Like, that would be more of a truth, but like perceived as negative, right? So catch them doing good. Give them some praise. Give them some potential rewards for being amazing kids that they are and believing in themselves. And that will help build their confidence. From you as a parent or caregiver can build this and wire this confidence into them as they're developing. Trust me on that. I see it where parents did a great job, or life and parents did not do such a good job, and they really hurt their kids as they get hardwired into their beliefs about themselves. Another one that's highly important is support friendship building. Initiate things for our kids. I can't tell you how many times my kids have been like, I don't want to do that. Like, that sounds weird. Like, even just an example of that, not even with a friend, but I made my daughter call up her theater studio yesterday for the first time ever, like making an adult kind of a call, because I wanted her to ask about what time her dance classes were. And she was like worried about it. She's like, oh, what do I say? And she's like, super smart kid. And she was like, well, what do I say? Like, what do I do? What? I literally paused and I said, stop acting like you have no idea what to do. Get your emotions in check. Make the phone call and trust yourself. And she was like, oh, okay, and she did. And she did it amazingly, which I knew she could, right? But her anxiety kicked in, and a lot of times if your kid's introverted, or just, it can be socially awkward for kids now because they're so used to things online. So when they do things IRL, aka in real life, like, it's very different for some of these kids growing up in this tablet and video game, virtual video game kind of age. So initiate those things for our kids, sort of force them into these social interactions, which is good for them, in my opinion. And then also teach them assertiveness. Like, that is something that I'm instilling into my kids all the time, of being a leader and not a follower, and speaking up for yourself, getting your needs met, and here's how to do it. So that is another one that if we want our kids to thrive instead of just survive, I think we need to have them be confident and comfortable in asserting themselves in lots of interpersonal situations. And then a couple other things here is peer pressure. Like that is another one that goes back to the leadership versus being a follower, and just talking to them about how to navigate that and what they need to do, and what does a leader look like when people are peer pressuring you. And another one that is related to this is just bullying. Like these things happen all the time. I can't tell you how many times my wife has come home from work and said, well, this bullying thing happened with this kid and this bullying thing happened with this kid. And she works at an elementary school, right? And so imagine middle school and high school. So like these things occur, and we need to prep our kids for this as best we can. We're not going to be able to prep every situation of like, so when this bully does this, here's what you do. But we need to go over some of those scenarios and some commonalities about how you want them to respond to peer pressure or bullying. Some parents are like, well, punch them back. And some are like, no, you need to talk to the teacher. Or some of them are like, no, just tell me and I'll handle it with the teacher. So it just depends on your personal beliefs, but that your kids need to know what these are, because there's a lot of gray areas with this. And if you're gray about it, you can imagine how gray your kids are about it. So yeah, these are some really important things we needed to highlight here. We're going to have a few more slides here, and then we'll talk about your EAP benefits, and then also we can have a Q&A session for a couple minutes as well. And if you have any questions, feel free to throw those into the chat as we go along here. I'm monitoring the chat on the right side of my screen. So, but for the parents out there with neurodivergent children, this is something where there's some extra needs there for your kids, and for you as parents and caregivers. There's a lot of amazingness that come with our neurodivergent children, but there's also some struggles, and we need some specific strategies to work on with our kids and get them ready for back to school. So there is a whole page dedicated to this on your handout that you'll receive after this via email. But a couple things I wanted to highlight here is to double down on your routines. Really make sure that they understand what the routine is going to look like. Make a visual schedule so they can visualize what they need to do appropriately throughout each day. Try to use social stories or like fictional characters so they can try to get it and have it click in their minds. And then also write an about me letter for their teachers. So like, listen, your teachers are meeting these kids for the first time, but you've been raising them for 5, 10, 15 years. So try to do an about me letter to let your teachers know a little bit more about your kid, their ins and outs of how they function, what triggers them, what's going to make them be successful in the classroom. So a one-page letter, which should take you 10 minutes or so, could be amazing head start for your teachers to understand your kiddo much better that has some special needs, right? So, and then one last thing about this is if your kids need like an IEP or a 504, I know these are confusing words and letters, but it is confusing for many people, even the people in the academics. But like, talk to your advocates, talk to your counselors, whoever you can talk to get a better understanding of what support our neurodivergent children can get in the classroom. There's been many times where parents just thought their kids like had difficult reading, but turns out they have a learning disorder or dyslexia or whatever it might be. So these are things where if you see something, say something to the appropriate professionals and try to figure out if there's any other supports or interventions that they can have in the classroom and outside of the classroom as well. And then the last few things that we're going to talk about here before we finish up is just the year-round keys to success. And this first one, I want to focus on you all for a second. So whether you're watching the recording or in here right now, what is one form of self-care that you can do to help de-stress, to help be the best version of you? Just one thing. We should be doing lots of self-care, but type it in the chat or just think about it if you're watching this remotely. And just what is one self-care that you should be doing more of, but you just haven't done it as much as you should. So think about that, type some of those into the chat, and then try to advocate for yourself to do more of that, right? Like, I know it feels like there's no time for any of this, which sometimes that is true, but also that you can probably find the time. Like somebody mentioned on the chat, like, a few minutes ago, just breath control. That's something that we can do within 30 seconds. Right? We can do that at our offices, at work. We can do that when we want to clock out of work at 5 p.m. We can do that when we're stressed, like, right? So that's a simple, easy one, but there's many other forms of self-care that are mental, emotional, behavioral, physical, social things we can do to help us be successful with this transition back to school. And so for you and your kiddos, think about sleep habits. Sleep hygiene is a big one that I advocate for. We do whole presentations on just sleep because it's so important for the mind and the body. So think about what your sleep hygiene is, get some resources from our EAP program to help you with that as well. And also for your kids. I mean, my kids start school at 7:25 a.m. I always hate it because I'm like, there's not even the sun out yet. Like, this is ridiculous for elementary school kids. So like, it's important to have their night routine squared away to where they can promote good amount of sleep, good quality of sleep, and be able to be productive the next day as opposed to cranky. Like, you have those kids that are like, if they don't nap or they don't get enough sleep, they are bad news the next day. Like, yep, I got one of those, right? So we got to watch out for those moments, and we need to set the tone for making sure they get a good night's sleep. Regular meals, I think meal prepping on a Sunday is so vital to having good, nutritious, easy meals for the rest of the week versus like me, if I don't do that, then I'm eating fast food or unhealthy foods as compared to the healthier meal prep items that I'll do on a Sunday. And it's also good for just, the belongingness with the family, just trying to promote having dinners and talking about your favorite day or the favorite thing that happened in the day. Like, just these are moments that are precious, and we need to value those and promote those in our households. Physical activity. I mean, I know they get recess, but like, what are they doing at recess? Are they running around? Are they just sitting doing nothing? So keep physical activity in your kids' regimen, but also for you as well. It can go a long way for your emotional well-being as if you take care of your physical well-being with exercise. And then also with checkups, do preventative care with you, your kids, just get in there sooner than later, get your baseline for what your numbers are, get your blood work. Same thing for your kids. Like, they can either spot things that need to be changed, or they can confirm that everything's going well with regards to their physical well-being. So these are all things to just think about. We're going to talk about some more keys to success for the year round as well. And then we'll talk about your EAP in just a couple minutes. But morning expectations, I don't know about you guys, but for me, it is just a scramble, a mad dash sometimes to, just figure out what's going to happen in the morning. So do as much as you can the night before or the afternoon before to get everything ready to go. We talked about the night routines and, just with all these different activities, those are really important. I think diversifying your kids' portfolio is great, but also unstructured downtime is always good too. Like, even me, like, if I go to the beach or something, I'm like, okay, I got to bring this, I got to bring this, I got to bring that. They got to do this and that. And then when they get there, they're just like picking up seashells and like skipping them in the ocean. And like, they don't need all this structure. They don't need all this video games. They don't need all these things to do or manipulate. Like, just let them go roam, let them go play, let them figure out imaginary games to play. So like, that's something that I think helps me remember that I don't need to have so much pressure to make sure that they have a structure, they're doing this and that at all times. Like, let them have some fun for a change and give them some healthy downtime. Last thing I want to highlight here is just, again, try to be involved and engaged as much as you can be. It is pretty tricky. I know we're all working really hard at Chicago Transit, but you guys try your best to be involved and just help out when you can, even if it's not a lot. Just a little bit will go a long way with your kids, with the teachers. Get to know the staff, like I mentioned, and just know who your go-tos are. Like, there's many times where it's like, do we talk to this teacher or that teacher or this vice principal, that vice principal? So try to get an understanding of just who the chain of command is, and that'll be great when if something does go awry, then you can just know who to go to at all times. And so the last thing I'm going to mention is, on that note about knowing who to go to, you can go to the EAP program for lots of different support. And I'll actually work backwards on this one since we're talking about it. There's lots of different things from the non-mental health perspective that you all have access to. I don't know all those benefits fully because I'm the mental health guy, admittedly, but I do know you all have access to things like, for example, legal services. My understanding is you wouldn't have access to someone to be your lawyer, but you might get a percentage off for legal fees, or you might also get a free consultation with a lawyer. For example, you might get like a 30-minute conversation with a legal expert. If your kid or yourself might have a potential legal issue, you can reach out to the EAP and get some guidance, have a consult with them, and they can point you in the right direction, give you some great resources if you don't feel like trusting AI or Google with a legal issue. So again, I don't know your exact services, so don't quote me on that, but you do have access to these types of services. And then I'll work my way up now to the unlimited telephonic consultations with a mental health provider. That's when I was talking about those coping skills. Or if you just want to learn more about anything under the mental health umbrella, you can just talk to a mental health expert on the phone for an unlimited amount of times, and just get some guidance, get some resources, get some tips, get some tricks, get some strategies. And those are free to you and no sort of therapeutic commitment to that. And then all the way at the top, you all have up to 6 free sessions to meet one-on-one with a mental health provider for therapy sessions. And this goes for you. This goes for your kids, your loved ones, your spouses, partners, relatives that live with you in your home. They have access to these free 6 sessions as well. And that is 6 for you and 6 for all of them. It does not take away any from you. Each person in your household gets 6 free sessions to meet with a mental health provider. So in my opinion, very low risk. Worst case scenario, you waste 45 minutes of your day and didn't get much from it. Best case scenario, they can change you or your kids' lives for the better, right? And that's what we're here in the mental health field for, is to help people and increase their well-being. So I hope I did a little bit of that today with this whole presentation about navigating these challenges going back to school. If you need some more information, again, use your EAP program, use your handout that's going to get emailed to you. You'll also get emailed a survey about how I did as a presenter. Would love some feedback as well. But again, I truly hope that you all took something from today that you can utilize right now when your kids are going back to school. So I wish you all nothing but the best. Really appreciate you all being here. I'm going to hang out for another minute or so, see if there's any questions or comments at all. But if not, again, I really hope this gave you a little bit of perspective of what to look for. Maybe that's your child might struggle with. So doing some preventative care, getting ahead of things, and then also having some ways to intervene, whether it's you doing the intervening or getting your EAP on board to help you do the intervening that will help them navigate those tough challenges. So I don't see any questions here in the moment, so I think we'll be able to wrap it up here. But again, thank you so much for having me. Wish y'all nothing but the best in this journey of this next academic calendar year. And hopefully I'll see you all again in the future. All right, so be well and take care, everybody.
Thanks, Dr. Scott. Appreciate it.